Bismillahirrahmanirrahim. Assalamu alaikum. In this video, we will study about the hypoglycemia. So, hypoglycemia is a condition in which the blood glucose level falls to a level about less than 50 milligram per deciliter. And generally, if we see it is characterized by some central nervous system symptoms which include the confusion, aberrant behavior, or coma. Hypoglycemia is actually a medical emergency situation because central nervous system has an absolute requirement for the continual supply of the blood-borne glucose, and it does not need the insulin for the transport of glucose, so it just needs the glucose directly from the blood. Transient hypoglycemia can cause the cerebral dysfunction, but the prolonged hypoglycemia can cause the severe brain damage. Therefore, body has multiple overlapping mechanisms to prevent or correct hypoglycemia. We will see these all corrective mechanisms. Most important hormonal changes in the hypoglycemia are increased secretion of glucagon and increased secretion of the catecholamines combined with the decreased insulin secretion. Now we will discuss about the symptoms of the hypoglycemia. If we see the classification of the symptoms, it can be classified into two general categories of symptoms: adrenergic symptoms, which are also called the neurogenic or the autonomic symptoms, which include anxiety, palpitation, tremors, and sweating. And these are actually mediated by the catecholamine release. Primary catecholamine that is released in case of the neurogenic or the adrenergic symptoms is the epinephrine. And these type of symptoms are regulated by the hypothalamus in response to the hypoglycemia. Adrenergic symptoms actually occur when the glucose level falls abruptly. Now this was the first category of symptoms. Now if we see the second category of the hypoglycemic symptoms, these are the neuroglycopenic symptoms. So the word penia means the less and gly means glucose, so this is the decreased amount of the glucose towards the nervous system. These symptoms are the neuroglycopenic symptoms, and they actually result from the impaired delivery of glucose to the brain, and the impairment in the brain function then results in the headache, confusion, slurred speech, seizures, coma, and eventually death. So if we compare the two types of symptoms, we saw these type of symptoms, neurogenic or the adrenergic symptoms, which were caused by abrupt decrease in the glucose level, whereas the neuroglycopenic symptoms are caused by the gradual decline in the glucose level. These symptoms include the anxiety, palpitation, tremors, and sweating, and were mediated by the catecholamine release. Whereas if we see the neuroglycopenic type of symptoms, they are caused by the impaired delivery of glucose to the brain and impairment in the brain function, and they include the headache, confusion, slurred speech, seizures, coma, and death. Neuroglycopenic symptoms often result from a gradual decline in the blood glucose level, and slow decline in glucose deprives the CNS to fuel and fails to trigger an adequate adrenergic response, so it is more dangerous than that adrenergic symptoms. Now we will see the two types of glucoregulatory systems in our body. One is the pancreatic alpha cell, which releases the glucagon, and the other is the receptor in the hypothalamus, which trigger the secretion of the catecholamines, adrenocorticotropic hormone, and the growth hormone. Now if we see the functions of these hormones, if we see this diagram, so when there is the low blood glucose level, the hypothalamic regulatory centers senses this change and signals the pituitary to secrete the adrenocorticotropic hormone. This hormone then acts on the adrenal gland, and then adrenal gland secretes two types of hormones. Its adrenal cortex secretes the cortisol, and the adrenal medulla secretes the norepinephrine and epinephrine, and the pituitary gland also secretes the growth hormone. Then this growth hormone is also involved in the other type of functions, and this low blood glucose level also acts on the pancreas alpha cells, which secrete the glucagon. Now we see the functions of these three types of the compounds. We can see that cortisol is involved in the gluconeogenesis, so it is involved in the production of the glucose. And if we see the norepinephrine and epinephrine, which are the catecholamines, they are involved in the promotion of the glycogenolysis. They promote the breakdown of the glycogen and also the breakdown of the lipids. And if we see the glucagon, it increases the blood glucose level by both of these. It promotes the glycogenolysis, breakdown of the glycogen, and it also promotes the gluconeogenesis, production of the glucose. The four major types of the hormones that are involved in the regulation of the blood glucose level during hypoglycemia are called the counter-regulatory hormones, because they oppose the action of the insulin or glucose use. These are glucagon, epinephrine, cortisol, and growth hormone. Glucagon and epinephrine are most important in the acute short-term regulation, whereas cortisol and growth hormone are very important in the long-term regulation of the glucose metabolism. If we see the glucagon and epinephrine, we have seen that glucagon promotes both the glycogenolysis and the gluconeogenesis, whereas epinephrine is only involved in the glycogenolysis. And epinephrine also inhibits the insulin secretion and prevents the GLUT4-mediated uptake of glucose by the muscles and adipose tissue, as it decreases the utilization of the available glucose in body. We will see the classification of the hypoglycemia. So there are four types of hypoglycemia: insulin-induced hypoglycemia, postprandial or the reactive hypoglycemia, fasting hypoglycemia, and alcohol-related hypoglycemia. First of all, there is the insulin-induced hypoglycemia. It commonly occurs in the patient with diabetes who are receiving the insulin treatment, and due to the excess of insulin, the body utilizes most of the glucose, and therefore they are in a state of hypoglycemia. Mild hypoglycemia in this case can be treated by administration of the carbohydrate orally in a fully conscious patient. But if the patient is unconscious, the treatment is by injecting the glucagon subcutaneously or intramuscularly. Now, if we see the postprandial hypoglycemia, it is the second most common form of the hypoglycemia. It is a transient type of hypoglycemia that occurs after meals, and it is caused by an exaggerated insulin release. It does not require a specific type of treatment, and the blood glucose level returns to normal after some time, and the only treatment is that patient should eat frequently small meals rather than usual 3 large meals. Fourth type of hypoglycemia is the alcohol-related hypoglycemia. Alcohol is metabolized in our liver by the two oxidative reactions. In the first oxidative reaction, ethanol is oxidized to form the acetaldehyde in the presence of an enzyme alcohol dehydrogenase, and in the next oxidative reaction, acetaldehyde is oxidized to form the acetate presence of an enzyme aldehyde dehydrogenase, and this step can be inhibited by a drug disulfurium that is given in the chronic alcoholism, and it results in the increased level of the acetaldehyde, causes the symptoms like palpitations, tachycardia, hyperventilation and nausea. If we see in both of these oxidative reactions, electrons are transferred to the NAD+, that is the oxidized form of the nicotinamide adenine dinucleotide. As a result, the reduced form NADH is formed. These levels of the NADH then promotes the conversion of pyruvate to lactate and conversion of oxaloacetate to malate. Now both of these, pyruvate and oxaloacetate, are the gluconeogenic substrates or are the gluconeogenic precursors and are utilized in the formation of glucose. This level of the oxaloacetate and pyruvate prevents the formation of the glucose and diverts the pathway of glucose formation towards the formation of other substances such as lactate and malate. Glucose level falls below normal and hypoglycemia occurs. An important point to be noted is that if there will be the decreased amounts of the oxaloacetate, it will allow the acetyl-CoA to be diverted towards the ketone body formation in the liver, and that will result in the ketoacidosis. Hypoglycemia can also produce the other behaviors of the alcohol intoxication that include the agitation, impaired judgment, combativeness, etc. And the patient should be counseled properly that if they are receiving the increased amounts of insulin, and that may cause the hypoglycemia, so they should avoid the alcohol because alcohol also causes the hypoglycemia. So this was all.